on my right over here, I have Ntinga, which means, comes from a isiXhosa proverb, Ntinga Ntakandini, which means commanding eagles to fly. And this is the African name given to the first drone from the South African National Blood Service, which is an eVTOL. So there's always some words wherever you go in technology, there's acronyms, and eVTOL means a vertical takeoff and landing aircraft. So it takes off like a helicopter, it transitions through folding the props forward into a very efficient aircraft, and then when it lands like a helicopter again. So this has been a novel innovation, pretty much a world first for the South African National Blood Service, in that what we've tried to do is to really solve for coverage for patients in rural areas. The call to action was the maternal mortality rate in South Africa, which is about 123 per 100,000. We ranked 121 out of 138 countries in the world for killing young women. So not really something we should be proud of. And as the blood service, we were, I think, confronted by Department of Health and worked with them on how do we actually get to these midwife obstetric units in KZN, in Eastern Cape, in areas that are quite far away from traditional hospitals, so typically the midwife obstetric units. And this really is an effort to improve coverage. The other part of the South African National Blood Service strategy, of course, is reliability. So for the first time in South Africa, we have more than 10 days stock of O negative. For the last 82 years, we've been kind of hand to mouth. We've had 1 day stock or two, which has resulted in spiraling costs and a lack of access. And thanks to all of you, many of you that are blood donors, and if you're not, there is a blood service team out there willing to bleed you. The vampires are here. But certainly improving access and universal healthcare is entirely what this particular project is about. So thank you very much.
Thank you. And so that went a little bit backwards. So I'm going to introduce Jonathan Louw. He's as the CEO of the South African National Blood Service. But we just thought we'd talk through that, and he was kind enough to bring the drone. They don't use that thing for delivering drinks onto the 18th hole as well at the blood.
Not yet.
Yeah,
Not
okay.
yet.
But we first use our technologies to help us, and then we use them to make our lives more convenient. Okay. And Fanie Hendriksz is, no particular order. And then Marlon, so Fanie is from ePharmacy. Marlon is from a company called Afrisky Holdings, also a medical devices company. And Clyde Lewis is the Chief Commercial Officer of GE. Thank you very much for all coming out today. So we are going to change track slightly, so I hope you're getting it now. So now we're on health technology, and we will be going onto the afternoon with this afternoon session on artificial intelligence as well. So what I'd like to know, and I'll start off with you, blood's a technology, eh? It's like would you look at it like that or not?
So I think blood per se and blood products do involve a lot of technology. So when it comes to quality and safety, South Africa's had amongst the highest disease burden in the world. We all know the scourge of HIV, hepatitis, etc. And we've had to embrace very quickly the almost world-leading technologies when it comes to making sure that the blood that we provide the South African public is safe. So the first thing I said is that there wasn't enough blood. But what we could say as clinicians out there is that at least the South African blood is safe. And that was as a consequence of implementing nucleic acid amplification testing almost before anyone else in the world did so. So we were, in many ways, the testing ground for that. Your blood isn't just transfused straight from your vein into another patient's vein. It goes through a whole lot of testing and processing and separation. And we use all sorts of components. So we might use plasma, we might use platelets, we might use hyperimmune gamma globulin in certain patients that have had exposure to certain diseases and have very high titer rates, as we would call it. So there's all sorts of mechanisms and uses for blood. So ultimately, your blood does save lives, and the technology applied to it really is world-class in our country.
So what percentage of your cost is technology and keeping up? Do you as a CEO spend a lot of time thinking about that and what its possible impact? Sorry, I know you've got this. Maybe I'll give you a rest. I'll come back to
That's
you.
okay. I could talk to. Let me cover it quickly. So, our strategy really talks to 4 key metrics, and we like to measure a mission statement. And those are firstly cost, secondly reliability. Are we a good supplier? Can you get blood whenever you need it? Because otherwise people die, and you can't run hospitals. Thirdly, coverage. Are we getting to everybody? And then fourthly, quality. So we measure all of those specific instances. And having let's say, a very diverse population in South Africa, and a large portion of our population is rural, almost 30%. So we have to be in a lot of places. So for that reason, we have 185 sites. We employ almost 3,000 people, and the cost of our staff is therefore almost 40% of our cost input. The rest is reagents and, of course, the technology that we apply. Yeah. So we are really a not-for-profit. Just going back to the previous discussions.
What's the blood bank's revenue, plus minus? Anybody had a look at it's
about 3 billion.
3 billion rand organization. That's what it takes to get you blood, okay? So I'm going to pass over now quickly to Fanie. Fanie, can you tell us a little bit? So this session is really just to showcase some technologies and what's happening in the technology space, and that what do you guys do, and how do you see it contributing to better outcomes?
Yeah, so I think, so I'm the managing director of ePharmacy, and it's in essence, it started about 4 years ago as an innovation startup, and what it was about was actually to implement technology which wasn't tested and matured in the South African space. South African innovation, but in essence the flagship is the ATM pharmacy that dispenses chronic medicine to public patients. So that was initially the I would say the start of everything. But we're a bunch of guys that actually were fortunate to be given the opportunity to move into public health, all coming from private sector. So we soon realized that there's a massive gap. So it was very exciting with the project, and we still, up to date, we've got about 18 ATMs functioning in the public space. But it evolved, and we're actually now on 9 different, I would say, solutions, all in the public health space. So, so we're all about, when everybody drops off medicine, that's where we would like to say that we start. So we're all about dispensing, distribution, and very important, the collection of medicine by public health patients now.
Okay. Then how, so, and was that mainly in HIV? Or?
Currently it's about 62% is HIV. We're adding comorbidities as we speak. Some of the other technologies include like public health in-pharmacy automation, which we are still the only company that's done that successfully in 3 hospitals. And then obviously on the collection side, we used Amazon lockers to actually ensure that patients can collect at any convenient time and place for them. So, and then there's a lot of other things, you think, I think all the administrators here, you work with nappies and all of that, nice things to have in the private sector. As soon as you go into public health and medicine, you soon realize that you firstly need to have a stock master file, and then you need to add the nappies, and then you need to link it. So, we're very proud that we can tell you which patient, ID number, age, gender, etc., gets whose drugs. There's a lot of pharma here, and I think it's tough to know who's actually using your medicine. Yes, you maybe get a tender, but you can't drill it down to patient level.
Yeah. Clyde, if I can ask you, how are we going to solve this problem in healthcare of technology or innovation being incrementally more expensive? So everywhere else not everywhere else, it's not true, but in many applications, innovation's cheap, that make things cheaper. We get this recurring complaint in healthcare that the problem is that we innovate more and more, but it gets more and more expensive.
So I think, some of the previous panelists actually discussed and covered a couple of key points on that. But, today you've really got to think through from the patient journey and work with the different providers. And if you really think about it, the barriers that we face today is cost, distance. If you really take like Africa, for example, 70% of the population in Africa is living in rural environments. So, the need to be able to deliver and think through building a very different, affordable, relevant, economically and clinically relevant product line, I think is critical. You can't do that anywhere else today. So, and even if you contrast that, we do a lot of work together with our technology partners in our innovation center in India, in Bangalore, in China, in different parts in the US. And we've been providing and building technologies very specific for the local South African and African market. So, previous speaker Jasper spoke about examples of taking ultrasound as a portable ultrasound device and utilizing that in another country. We've actually done that here in Gauteng. So in the last 2 years, we took adapted portable ultrasound. We worked with 7,500 expectant mothers through their antenatal cycle. And quite proud of the fact that 96% of those patients had ultrasound for the very first time in Gauteng. We had just over 15% of those referred, up into a secondary facility because of a potential complication, and we had 200% utilization. So I think the impact in thinking through what we really have the capabilities of doing today, I think is there. But I think the more important is really thinking about the partnership between private, public, NGOs, and thinking through how to scale that. And I think that's where we sometimes come short. Is we tend to all want to be able to play our different roles, but the ecosystem and the sustainability around that and delivering the ability to deliver the right care to patients is really about that. So there's multiple examples of that. Just another quick one, talking about technology. GE has, in the World Health, WHO's compendium of innovative technologies, GE has 9 evidence-based proven technologies to be able to be used in the space of maternal and infant care. And that's been deployed across all of South Africa and Africa today. So if you're looking at everything from basic portable ultrasound, working with certified midwives, to LED, phototherapy, lullaby warmer, basic warmers that are utilized. So, and if you contrast that, just because, speaking about NHI in the private sector, you can go down to Hendriksz and you can get, premature babies that are sitting in a giraffe incubator that you would have seen on carte blanche. And that there is a very expensive device. But at the same time, you can be able to offer very simple infant warmers in places in Africa that can, do 90% of what that is supposed to be used for. So I don't believe in the fact that you need to be able to all have a high point of technology and cost. We need to be bringing that down and to be able to offer what is needed in specific markets.